Hi, I'm Harry Rock, and welcome to another edition of the Westfield Council on Aging Presents. This is a special collaborative effort with Mike Squindo, Executive Director of the Westfield Senior Center, Tina Gorman, COA Special Projects Coordinator, and Pete Coles, producer of WCPC Westfield Cable Channel 15. Our topic today is understanding strokes. And with me in the studio is Christine Humason, sitting right here, is the nursing supervisor and stroke program coordinator. And at the end of the table is Tamsen Westcott, welcome, the emergency department education coordinator for the hospital here in Westfield with Bay State Noble. So we're going to be discussing strokes, what they are, how to identify them, the need for an immediate emergency response, and rehabilitation following them. So it's going to be everything that relates to this topic. So I certainly want to thank the two of you for finding some time in your busy schedules to come in and talk with us, because
thank you.
it is certainly a topic that everybody needs to know about. We hope it doesn't afflict us or any of our loved ones, but we know that it is a common occurrence among people, especially as they start getting older. And we'll talk about, kind of when do you have to start thinking about it from an age standpoint. But Chrissy and Tammy, really, we're thrilled to have you here in the studio. So let's talk a little bit, first of all, just what your roles are at Bay State Noble here in Westfield, and what your primary responsibilities are, and how you two interface, because I know you come from two different departments and working together, a tag team, so to speak. So Chrissy, I'll start with you.
Absolutely. So I am a nursing supervisor for Bay State Noble, as well as I'm the stroke program and STEMI program coordinator. So what I do is I oversee our stroke program, which pretty much encompasses all stroke-related things at Noble. So when stroke patients come in, we review stroke patients' policies and follow up with patients and whatnot like that.
And if I have this right, you're also you're a member of the Westfield Fire Department?
Yep, I'm a firefighter paramedic for here in Westfield for the fire department.
So you see both sides.
I do. My background is mostly emergency medical services. I've been in EMS for 29 years now.
Is that right?
Yep. So that's where my background is, mostly in emergency services, and obviously I'm also a registered nurse. So I see both inpatient and emergency. So.
All right, I think you're definitely you're well qualified to talk about
Jack
this.
of all trades, this one.
Right, and Tammy, and how long? I'm sorry, how long have you been at Noble now?
I've been at Noble for over 10 years.
Wow. Okay, great. And how long with this program? Has it been always with this program?
No, so I started in the emergency room as an emergency nurse at Noble.
Okay.
I came from the Berkshires initially, and then in 2015 I started at Noble.
Oh wow.
So I've had, actually I've worked with Tammy in the emergency room for many years before this, so.
And Tammy, you were also in emergency room?
Yeah, since
Nurse?
2015. Yeah.
Wow.
Coming up in 10 years as a nurse. But I've been at Bay State for over 20 years. I was at Bay State Noble before it was Bay State, when it was just Noble Hospital.
So you've been here for 20 years?
Yeah, and at Bay State Noble right here in Westfield for over 20 years. It's been amazing.
Your primary role now is?
So right now, I am the emergency department nursing education coordinator. So I help all of our nurses and our staff in the emergency department with teachings, classes, orientation, and anything that has to do with our work in the emergency department. I help them out.
Wow.
Yeah.
Wow. Oh, very cool. Well, thank you for your service to our beloved city of Westfield and trying to keep us safe and from a standpoint of medical emergencies. So let's talk about stroke education. How long has this initiative existed? And this is a relatively new thing that you're doing, this education piece?
Yeah, so we had the opportunity to apply for a grant this year,
Okay.
and we were awarded to bring stroke education out into the public. This was in collaboration and partnership with Borderland Partners, LLC. And so basically what it is we are trying to reach out to as many people as we can in the public and bring stroke education and bring awareness to early recognition, early interventions, getting ready for EMS, what to expect when EMS arrives, what to expect when, throughout their care, things like that. But the early recognition is our main focus, is, the time is brain is what we say for strokes. And the faster that you get the care and, is the best, outcomes. So.
Yeah, we're going to talk a little bit more about that in
Yep.
depth. I'm curious, so when did this, so you're on a grant. When did the grant actually take place?
It's just recent.
Oh, so this is
this is
fairly
all.
new.
Yep, this is all. We're all in the beginning stages of it right now.
So
this is actually
so
one
we've
of our
got you
first
right at the
outreach.
start.
You got us right at the start.
First, yeah.
Oh, we're the first. I like that.
Yep. So we're bringing out the stroke education, and it's really helping us to reach out, because Noble really encompasses, throughout the hill towns. We have a very large area that Noble services. So we're trying to get out to as many people as we can, especially in the elderly population who are at most risk
Right.
for strokes. So.
And how long is the grant for? How long will this initiative be going?
So we have a few months that we really need to get out there and do this also.
Okay, so it's a concentrated
it's a very
effort right
concentrated
now to
effort,
get
yeah.
this word out and make sure that people.
But it's not going to stop us in terms of educating. We're going to continue, with this collaborative and,
Right.
and getting out into the community.
Right. So you're going to be going into different companies or schools, or what do you see this looking like as far as your way of getting the word out,
Yeah. So right now we have senior centers. We are going to, I think, the Women's Club.
Oh, yeah, sure.
We are doing some Rotary work in Southwick. Everywhere who will let us in, we're going in, because we're just excited to go out to the public. Like Chrissy said, this initiative is newer. It's amazing. We're both looking forward to it, because normally, we see the patients when they're already at the hospital.
Yeah.
And because of this grant, we're able to meet people out in the community, and before they have to come in. And if they have questions, this is a time, ask us what you've got. Come at us. We're ready for it, and we want to help you, as quickly as possible, because it's a time sensitive thing. Strokes
Yeah.
are so.
So the purpose of the grant, it's a private. Where's the grant coming from?
It's through Borderland Partners, through DPH.
Oh, okay,
So,
Department of Public
yep, so
Health.
we actually have partnership with Westfield Fire and Southwick Fire for their respective communities. So they're actually going to have some of their members coming out with us as well.
Oh, wow.
And, we're going to be taking blood pressures and educating the public, and they're going to be interacting with everyone. And our big thing is to get them to, the symptoms and how to recognize, utilizing the BFAST acronym. So we're, it's going to be a lot of just, get out and work with the public and really try to get our what we're trying to teach out there.
Yeah, and their motivation is to hopefully make the public safer, more aware of what's going on, and for quicker response, I'm guessing. If they
Absolutely.
they can identify right away that, hey, this is something,
Yeah.
don't sit around and let's see if it goes away and
Exactly.
everybody's fine.
Yep.
But you need to react. I was doing some research trying to educate myself around this topic because I didn't know anything about it, and what I came across on is very time sensitive.
Yes.
So, but we're going to talk about that. So can you talk about what is a stroke? Let's just start the very beginning. What is a stroke?
So a stroke is a neurological emergency. It's when the blood flow to a part of the brain, it could be different parts, is blocked or reduced. So there could be a clot or there could be a bleed. So that's what's, because the blood or the brain relies on the oxygen from
Right. Right.
and the nutrients from the blood. When the blood supply is interrupted, that's what's causing the stroke, and could lead to serious damage, injury, permanent damage, which that's why we say, time is brain.
So can a stroke be brought on like by an injury or falling and hitting your head, or is it just something that just happens? What?
It could be any of those.
Okay.
So if there's a clot, that could be, if due to, medications, if people aren't taking their medications properly.
Okay.
An injury, a fall, a big hit to the head, any of those.
If they fall and hit their head, they definitely need to be checked out.
They should be checked.
They should not just wait and see if
Yes.
everything's going to be
Yeah.
okay, kind of thing. And you mentioned either a clot, which people, I think, can relate to, because we hear that all the time. When you say a bleed, what does that mean?
So that's when like the blood vessels in the brain, it like bursts, or there's like
Okay.
So a weakened area of the blood vessel in the brain can
Yes.
let go. So it can cause bleeding in or around the brain.
Okay.
So that's a hemorrhagic stroke. The other one is the ischemic stroke, which is the blood clot. So there's basically something that is occluding the blood vessel so that the blood can't get to an area of the brain.
Okay, so there's two types of strokes.
The ischemic and hemorrhagic.
Okay.
Yep.
Ischemic and
Just-
hemorrhagic, okay.
ischemic is the clot and the hemorrhagic is the bleed.
So ischemic strokes actually account for about 87% of all strokes. It's from a blood clot. So
What's the percentage, 80s?
87% of the strokes is ischemic strokes. And then hemorrhagic are not as prevalent, but they are out there, and that can be from a weakened area, like I said, in the blood vessel that lets go, and that causes some bleeding in or around the brain. So it is actually bleeding in the brain.
People who have high blood pressure, are they, for some reason, and am I wrong on this, that they are more
It's
at
acceptable.
risk for having a stroke?
Yes.
And is that because of because of the high blood pressure, the weakened blood vessels, so
Yep,
they would be
it
more
causes-
prone to the hemorrhagic?
Yep, so that's actually a risk factor for strokes.
Okay.
And we'll get all into further questions. We'll get into more
Yeah,
of the,
yeah,
the risk
sure.
factors
Yeah,
and
that's
whatnot.
interesting. But, so two types. And then what is a TIA?
So a TIA is a transient ischemic accident. So what that is it's actually a area that has a temporary blockage, causing a similar type stroke symptoms as ischemic because it's temporarily blocking. With the TIAs, they're also considered, they're also known as mini strokes.
Oh, yeah,
So they
sure.
can have stroke-like symptoms, but they can last only a few minutes as the clot is, passing through, or they can last up to 24 hours. But there's not usually any residual damage from that. But it is a precursor for a possible future stroke.
And that is a clot, essentially.
Yes,
It's
yep, or
passing
some type of blockage that's happening.
Okay, that makes sense. And then what creates a clot? Where do clots come from? How do they?
So one of the risk factors is high cholesterol. And just like when you have a heart attack, a clot breaks off and blocks. So it's the cholesterol and whatnot and the plaque buildup in the vessels and
Oh, so it's the cholesterol and the
yep.
plaque
So that's
buildup.
so risk factors like high cholesterol, high blood pressure. That's all part of the risk factors for strokes.
Okay, interesting. It's all starting to piece together here. So let's talk about warning signs that people. And I guess the first question I have is, if I was having a stroke, can I detect that I'm having one, or does it just come on? Am I able to think, oh my gosh, I think I'm starting to recognize some symptoms here. I may be having a stroke,
Absolutely.
or does
So-
it just immediately come on and I have no idea?
So one of the acronyms is Be Fast, and that's something that we're really trying to get out and for everyone to recognize. And that's one of the educational parts of this this grant is to how to recognize the symptoms if it's happening to you or someone that you are with. So with Be Fast, each letter is a symptom that could be possibly having. So B is balance. So if you have the sudden loss of balance or sudden dizziness. E is eyes. If you had sudden or double vision, sudden blurred or double vision. Or loss of vision in one eye. The F is with your facial drooping. A lot of people are, know strokes of having
Yeah.
facial drooping.
Right.
So you could have a facial drooping, even just numbness on one side of the face. And then the unevenness of the face, like you could notice the unevenness.
Right.
Yeah.
The arms.
Yep. Is there a drift? If you're holding them up, and that's what we in the medical field will say, hold your arms up and we'll see if, all of a sudden an arm drops down and they can't hold one side. It's a weakness we're looking for.
Yep.
And
It could also happen to a leg as well.
Yeah.
It may not just be the arm.
Okay,
and we'll check all of that once you get
right.
And then under speech, S for speech, so slurred or word finding difficulties or unable to comprehend what others are talking to. And then time is, obviously, the time is the essence where, call 911. So if you, it kind of gives you an idea of like what to remember of, of stroke symptoms.
Yeah, that's interesting. We'll review that a little bit later on again to
Absolutely.
make sure people have that down. So you mentioned, Tammy, that you could have weakness not just in the arms but in the legs.
In the
Can it
leg.
just be the legs and not the arms?
Yeah.
Could the arms be fine and the legs have a weakness where they can't hold them out,
so-
or vice
so-
versa?
So we'd be checking that with a neurologist, the medical professionals that are around. That's why we're checking everything. We're kind of checking head to toe. We're gonna have you smile. We're gonna have you stick your tongue out. Open your eyes really wide. Shrug your shoulders.
Okay.
Push, and then for the feet, we say, push down like you're pushing a gas pedal, and then like pull. We'd put our hands on there and say, all right, now like pull my hands up. To see are they equal, or is like one weaker than the other?
Right.
Is there any movement on one side? Sometimes
Right.
there's no movement on one side, or sometimes it's we notice it's a little weaker on one side than the other. And we always say, is this normal for you though? Some people might have I've had the different diagnoses that they have previously might impact what how they act normally. So that's when, we as healthcare professionals, we rely on, your friends, your loved ones, your families. They'll say, maybe they had a stroke in the past and they have a little bit of residual, weakness on one side. They say, well, that's normal, or, that's there, but this is worse. So we always want to know like what's their normal, and then how are they presenting today? That's the big.
And one of the big
Kicker.
things is the last known well time.
Yes,
That's something
huge.
to
The
always
last
remember.
what?
Last known well time.
Oh, okay.
So when EMS arrives, they'll actually ask that question, and when you get to the hospital and whatnot. But the last known well is actually very important. So the last known well is when they were last known to be at their normal. So what was normal for them? So they may have normal, like Tammy was saying, like normal weakness, but this is more profound weakness on the left side. When did this start? Like the estimated around the time of when everything started. When was this different for them?
That's interesting. I've never heard that term, but it makes so much sense. All right, so you have a sense of how long this has been going on. I think that a lot of people associate mouth droopiness with strokes. You can have a stroke without having that happen, or is the offsetting weakness on one side of the face always an indicator of a stroke?
It can be different for each person. Stroke affects each person differently.
So it may not
It may not be, but they may have balance issues. Or
Okay.
they may have, the arm weakness.
Okay, and I think that's an important distinction, because people do think of, when you're having a stroke, as, the face is drooping and stuff. What is the condition? Is it Bell's palsy?
Yep.
Where that happens. Now, that's not a stroke.
That is not.
That
No,
is
that's a
entirely
that's a
different
nerve.
thing.
Yep.
Yep.
That has something
But
to do with the
does
nerves.
that look similar
Yes,
to when you
looks
have a
very
stroke?
similar.
It looks very
Can
similar.
that be confused?
Yes, and we have people come in quite often, and we still will activate our overhead, what we call a code stroke in the hospital, to let people know that to clear out the CT, because we need somebody to get in there fast. And it turns out negative, but you know what? We'd rather have you come in. We'll have you get it checked out,
Right.
And
Yeah.
hopefully it's not. But if it is, we're gonna treat you just the same. So it's
Because with Bell's palsy, they also have slurred speech, is that
they
correct?
could, yep.
So there's very
So you-
similar
Very similar
symptoms.
symptoms. Yep.
So if that's happening, you've got to really
Come
go
in.
for the worst, hope for the best.
Yeah.
I'd rather have Bell palsy than a stroke,
Exactly.
obviously, but
We're open 24/7.
yeah.
Weekends, holidays,
on in.
holidays, all of that.
Come on down. We've got a deal for you.
We're there.
Yeah, you're there to serve 'em.
Absolutely.
Oh, I love it. So a person, so if I'm experiencing, I could potentially know that, oh my gosh, I'm having a stroke.
Yep.
And I may have lost now my ability to communicate, but I'm aware that something's going on pretty seriously. Do people lose consciousness? Can you lose consciousness having a stroke, or are people always awake and aware of what's going on?
You could.
could.
It's severity. You could be a a tiny clot that's been there for a long time. We could have people who they last saw their loved one, right before bed, and then they woke up in the morning. And that's, who knows what time the stroke happened. It could have happened quickly after, and then maybe there was a bleed that had been kept going, or, more of the brain was lost, unfortunately, due to the clot and interrupting that blood flow. But, yeah, it depends.
So
Unfortunately.
the clot, I know that, I forget what the bulk of the blood in the body is going to the brain to nurse the brain, because it's bringing obviously nutrients and most importantly oxygen to keep it healthy and functioning. So when a clot happens, a clot is happening and there's a lot of blood vessels up
Yeah.
there. Is it going to like a small one and it's just affecting one small part of the brain, or is it blocking off everything?
And that's the thing, it can be different for each person. So it could just be blocking a small vessel, or it could be blocking the main vessel that's supplying a lot of the small vessels.
Okay.
So it all depends on the size of the clot, how far it's traveled and whatnot. So that's why it's also very important to also, immediately call 911 and get checked out right away as soon as you start having the symptoms, recognizing that you're having symptoms.
Right. And then if a person has a clot going up there, I mean, we've talked about the importance of speed, but what's happening? The blood is not now circulating properly, and the brain is being deprived of oxygen, and that can cause
Permanent damage.
permanent damage. Okay.
So there's actually there's a reason why we really want to push as soon as you recognize that you're having stroke symptoms, when you come into the hospital, there is a time frame when we can give a medication called TNK. They consider it called the clot buster. But that's a time frame of when that can be given, and it depends on the patient. If the physician, the neurologist feels that this patient is a appropriate patient for that medication, but it's a time frame of when that medication can be given, and it's also a time frame of how long that they can have surgical interventions as well. So that the medication can only be given in a certain amount of time, as well as surgical interventions can only be done within 24 hours of time. So that's why it's really important. The faster you recognize it, the faster to get seen. If you're a candidate for this medication, if the doc will talk it over with the patient and the patient would like to receive it, if they're in that time frame, they can receive that clot-busting medication.
Yeah, that's really interesting. Can a person have multiple strokes?
Absolutely not. They can. So if you had one stroke, there is a possibility of having a future stroke. But the problem is the future strokes can be much more damaging and much more devastating for patients too. So that's why when you have a stroke, it's getting to know the risk factors and managing those risk factors, getting on the medications, doing your follow-ups, checking in with your doctors, following up with a neurologist.
Taking your medications as prescribed.
Following a
right,
diet,
right.
keeping your blood pressure in check, keeping your, cholesterol in check. If you're diabetic, keeping your A1C in check. So things like that.
Yeah, that's interesting. And so if you've had a blood clot, they're going to put you on a blood thinner as well, probably. Is that right?
It all depends on the patient and the physician. But
Okay, so it
Yep,
may
so-
or may not happen.
Yep.
Okay, got it. Are strokes more symptomatic with older age groups, or can you have a stroke at any age?
you can have a stroke at any age.
Oh, you can?
You can, yep. So things like autoimmune diseases and stuff like that bring in the younger population. Also like lifestyle, drug use, diet,
Traumatic
smoking.
injury.
Any type of injury, a fall, that injury to your neck or head that can interrupt the blood flow. So strokes can happen at any age. You're just more susceptible as you get older due to our aging of, our cholesterol, our blood pressure, our diet, our lifestyle.
Right. Is there a certain age statistically where you see a sudden jump in the incident level of strokes, or is it not necessarily?
It all depends on the lifestyle.
Okay, it's more, so it's not
Yeah.
age necessarily, it's based on how well people have taken care of themselves in their prior years. So take care of yourself out there. That's the key. All right, so actually, you've already mentioned some of this, but I want to go over that again. What are some of the preventative things that you can do to lower the risk of having a stroke? Because I think that's really important, because now is when they need to be thinking about that. If they haven't been doing some of these things, the sooner that you are taking preventative measures and changing your lifestyle, diet, things of that nature, getting exercise, it helps to at least control or lower the chance of having a stroke. So let's just go over some of those.
Absolutely. So preventive measures such as having, a healthy diet, taking medications, exercising as little as 10 to 15 minutes of daily exercise, of just getting up, moving around, going for small walks, significantly lowers your risk of stroke. Things such
really?
as
Okay.
smoking cessation, regular exercise with limited alcohol consumption, monitoring your health conditions, keeping track of, your blood pressure, your blood sugars, if you're diabetic, your cholesterol levels,
Right.
and, maintaining, getting the medications, refilled and whatnot, and staying on top of things like that.
Yeah, seeing your PCP for your yearly checkup, being honest with them. Tell them if the things are bothering you, especially like she said, that if you have high blood pressure, to keep a diary of it, knowing what your blood pressure normally is. Are you watching it? Say you take it 3 times a day. Sometimes we tell people who have new high blood pressure in the emergency department, keep a little notebook, take it 3 times a day, or if you're starting to feel funny, take your blood pressure at home and see what it is, and then you can kind of start to recognize the trends of like when your blood pressure goes up, what your head, do you get a little headache when your blood pressure is going up? Check those things out, and like talk to your doctor. So if they ask about it, you might need a quick medication adjustment, and
Right.
yeah.
And
Take
I
control
would,
of your health.
yeah, right. But I would think that the sooner people modify their lifestyle,
It's easier to maintain.
it really helps you to maintain
Yeah.
a healthy lifestyle, and it lowers the incident chance of having a stroke or other issues as well, heart attacks or anything else. But don't think that, well, I can do whatever I want until I'm 60. When I turn 60, I'll start cleaning up my lifestyle. That's cumulative
Yes, absolutely.
damage that's been done, and
Yep.
at that point, in some cases, it's really too late. So people really need to be thinking about their diet. I'd love the thing about exercise, absolutely. We've talked about that in this series,
Yeah.
the importance of getting regular exercise, and we've talked about diet. A lot of our topics relate around this, so really, really critical. Smoking is a factor of that as well?
Yes, smoking cessation, that's one of the things that, if you ever do come into the hospital and have get worked up for a stroke, we give you smoking cessation materials and offering the nicotine patches and stuff like that to help, get you off of smoking.
Right. And are diabetics more prone to strokes?
They are, yep. So one of the things, actually with the stroke initiative that we're doing is we have some little notebooks that we're going to be handing out so that diabetics and people with high blood pressure can actually keep a log of their sugars and, see when, what's making it higher or lower, and bringing it into your physician and having, that talk with your doc to see, is there a med adjustment, or do I need to change my diet, or do I have to watch, what I'm eating much more, closely? And so it's very, important to keep check of your A1C and keep your A1C under 7, which is a diabetic lab work.
Okay, okay. And they can, obviously, people who are diabetic, they're doing a pretty good job of managing their blood sugar levels. And
Hopefully.
Hopefully. Yeah.
That's the goal.
hopefully.
That's the
right,
goal.
Right.
Yes.
Yeah, okay, I like that. So let's go into the symptoms that signal someone having a stroke. And you talked about BFAST. I want to go over
BFAST,
that
yep.
again
Yeah.
so that
Absolutely.
people really have that, because I think that's a really important acronym.
Yep.
So that hopefully, as you listen to this, make sure you're writing this down or trying to memorize this and have this in the back of your mind so that you can recognize this with your loved ones or friends that you might see something funny going on. You can start running these letters through your head and saying, I've got some of these things happening. We need to really get some intervention here.
Absolutely.
All right, so who wants to
BFAST.
talk about BFAST?
All right.
B, balance. So
Okay.
that's the loss of coordination, sudden dizziness, walking like they like to say, like the drunk sailor, all of a sudden they can't walk in a straight line. The E for the eyes, blurriness in the eyes, double vision, loss of vision in one eye, all of a sudden. We have the
Yep,
facial
facial.
drooping. So, that's when one side is lower than the other.
Or even just some numbness in the face.
Numbness or tingling. Yep, you got it.
The arms. Yep. So arms is, the arm drift or arm weakness, but also can be a leg or legs. Your speech is slurred or strange speech or word finding difficulties.
Yeah. Sometimes we call it word salad. They can't, have a conversation. They're just talking kind of gibberish a little bit.
So to you, to the person, they know what they're wanting to say. So they're fully aware of what they're trying to say to you, but when
Right.
it comes out, it may be a complete different, sentence of words that don't go together.
Right. We're going to take a short break here, and then we'll be right back, but our topic right now is strokes, so we'll be right back.
Now he's been wanting to put garlic chives in everything.
Well, not everything.
Dad, the side of your face is drooping. Mom?
It's probably nothing.
Dad, are you okay?
You're slurring. Why are you slurring? Raise your arms up in the air for me.
Dad, are you okay?
Gracie, call 911.
I just
Honey? Tim!
need an ambulance to send for
Tim! Tim, look at me, Gracie. Tell them to hurry. Tim, look at me. Look at me, Tim.
Mom, what do I do?
I don't know. I think he's having a stroke.
I think my dad is having a stroke.
Tim, what's going on, baby? My husband, he. I think he's cold. Are you cold, honey? Are you cold? Okay. Gracie? See, Gracie's gonna come, sweetheart. We're just gonna go. We're just gonna go in the ambulance right now. We're gonna go to the hospital. Okay? Okay. Huh? I'm right here. I'm right here. Gracie, meet us there. I'm right here. I'm right here. Okay. Okay, here we go. You just stay right here. You just stay and breathe. Just breathe. Tim? Tim?
Dad?
How you feeling?
I'm fine.
Well, you've had a stroke. But because you got here quickly, you're looking at a full recovery.
So we are back with our topic of understanding strokes. Our guest in the studio is Christine Humason, the nursing supervisor and stroke program coordinator, and Tammy Westcott, the emergency department education coordinator. And we've been talking about BFAST, which is the
Acronym.
acronym, thank you, that's what I needed to know, of all the letters. So we've gotten through BEEFAS, and now we're at the T.
Time.
And
The most
what
important
is
part.
Time is the most
Most
important thing?
Yep. So that is a time to call 911.
Okay.
So stroke care starts right with the ambulance, with EMS. So the faster that you recognize the symptoms and call 911, the faster the care.
And so when they call 911, is that automatically going, where does that go? And is that automatically, regardless of what community they're in? So if they're in Westfield, Russell, Huntington, Southwick, does it know where they're calling from? And is it directing in the right place?
It goes into their PSAP center, so where their location of where 911 will answer for their area.
Okay, so they don't need to call directly to the hospital or anything. They just call 911.
They call 911, yep.
And that will tie into who they are, where they are. So, but the BFAS and that, I can't come up with the word all of a sudden, but the BFAS letters, you want to definitely have those memorized so that you can keep track of what symptoms people are displaying at any one time. So let's talk about if someone is having a stroke, obviously we're going to call 911 and get help as quickly as possible. Is there any immediate care that a first responder or a loved one or a friend can do to help somebody that they suspect is having a stroke?
So the biggest thing with patients that are having strokes is to keeping them calm, because obviously this is something new. This is something devastating to them. They know something is going on if they can't speak and they can't, get what they want out.
Right.
Or so they're going to be very scared and very nervous in that. So keeping them calm is the biggest thing. And also, like we said earlier about the last known when did these symptoms start? Because EMS is going to need to know, we're going to need to know when you come to the hospital. So when was their last known well time? When did these symptoms start? What's different from their norm? Something also is, when coming into the houses, if they have any dogs or any pets like that, to put them aside and into a different room.
Oh, that's a good one, right.
Yeah, and then having items together like their med list and their medical history lists. And one of the things with our stroke initiative that we're going to be handing out when we're going out into the
Yes.
public, and I know Westfield is very well known with these, is the file for life. And these are really important, even if they don't have the specific file for life, just having a list of updated medications and updated medical history and their allergies. But this is very, it's convenient, it's easy to keep, nice magnet right on their fridge. And they,
Police and EMS look for those too, because they know it has, this great information that we have. It has allergies, it has the pharmacy that you go to, because sometimes, we know medications change, but if you can write down what pharmacy you go to, we can call the pharmacy and get your medication list. But like, who's your person to notify? So just in case you are, at a grocery store and this happens, and you can't talk for yourself for any reason, who can we call that knows your wishes?
So we have talked about this in past shows, and I think that this is really important to have this. These are available through the senior center, I believe, or...
and we're actually going to be handing them out as well as part of our
Okay.
initiative. We have those, and we actually have the little wallet ones too, also that keep in like purses and wallets.
Right.
So when you are out at the store, and obviously if this is at home, at least you have something, a backup, just to have some pertinent info as well. And
Right.
the same exact thing, it has all
Oh,
your
wow.
medical
So that's a
info.
wallet size.
That's a wallet size.
But
Yep.
I can't emphasize enough the importance of doing this, especially as we get older and we have to start worrying about medical emergencies, of having this information immediately available. EMTs, police, they will know to go to your refrigerator. It's got a magnet on the back, and put this there so that they have all of your pertinent medical information in place. We've talked about this on prior shows. That's why I was glad to see this again as a reminder. And on here is a checklist of allergies, your medical insurance, medical conditions, your emergency contacts, data, your medications, your pharmacy, as they've just said. But it's everything that somebody would need to know, and it will really help speed up and make the care far more effective if they've got this information versus not having it. So, and especially if you're the only one in the home and you're incapacitated and you aren't able
Right.
to communicate. So, really important. Thank you for reminding us that.
And also another thing to keep with that is healthcare proxies.
Yeah,
And
absolutely.
having an active healthcare proxy, but having someone on that healthcare proxy that knows your wishes. So if you are unable to talk, if you're unable to make decisions, they know what your wishes are. And same with MOLST forms as well. When you go to your physician, some people have MOLST forms that are active.
So I saw that term MOLST, and I said, is that misspelled, meaning it's supposed to be most, or is it really MOLST?
MOLST.
And I said, I think it is. So what is that? What's a MOLST form?
So the MOLST form is something that you have a discussion with your physician, your primary care, or if you're in the hospital physicians can talk to you about. And what that is that you just express your wishes. In depth. So if you want to have an intubation, meaning the breathing tube put down and put on a
Right.
ventilator. If you
Want to be
want,
transferred to a hospital? Do you want artificial nutrition? It goes into like the big parts of it. Do you want somebody to do compressions on your chest if your heart
Right.
stops? And some people will say no, but you can intubate. No, but if, I need to be intubated, I can be intubated. But if my heart stops, don't do that. So they can say yes to some and no to some other things, and that's okay. But that's why you have to have that conversation with your doctor to do that. Like the healthcare proxy, Chrissy and I are going to have those with us as we're out and about as well. Because we can sign those and we can be a witness to those, but like the physician, they really need to talk with you about the most and, what your wishes are. And that's why it's important to talk to your family early about that. So they
Right.
know your wishes. So they're not having to decide in the moment when, anxiety and emotions are high.
Yeah, and we've heard that on some of our other topics too, so make sure you're having those conversations.
Absolutely.
Don't put them off. You really want to be in a position to help those that need to help you so that they've got your wishes in mind and well communicated. Can people recover from having a stroke and are the symptoms lifelong, or can they completely recover and continue with life as they once knew it?
Well, it all depends on the stroke, severity of the stroke. Each
Okay.
person, the stroke for each person is going to be different. Some are going to have very minor, and they can recover and have full recovery. Some will have, lifelong deficits from those strokes.
Okay.
So it all depends on the person and the severity.
And people that have had stroke, what happens in the hospital? So they've got immediate care going on. They're going to be kept in there to be monitored for a period of time. Are people generally in one day? They could be in a week, or is it the length of time they're in a hospital varies?
Again, it
from
all
person to
varies.
Definitely
person?
varies.
Yep.
But just know, like, as soon as you get, if you do have to come to the hospital, which we hope you don't, but, if you do have to come to the hospital, you'll see, our partners in EMS. And then when you get to the hospital, it's a lot of, you'll think it's a lot of chaos and a lot of people talking at you at once, but it's a controlled chaos.
Right.
We know what we're doing. We're asking you, we're putting in an IV, we're getting blood work, we're bringing you to CAT scan. We're asking you to smile, to stick out your tongue, to talk to us, to say, all dogs, have, I can't remember what is it? Something.
There's so many, so it's
a
basically
little
like
acronym.
short,
Right,
sentences
right.
that have you speak. Just
speak.
make sure that you can put words together.
Yeah.
Right.
So
Yeah.
it's a lot, but we say, we're here with you. It's okay. We have, we have you
Right.
now.
You're in good hands.
You're in the good. You're where you need to be. That's where we want you.
Yeah.
Throughout
no.
throughout your care, though, you're going to see people like speech therapy. You might see occupational therapy. You might see physical therapy.
Right.
You're going to see your hospitalists. So you're going to be, there's a lot of people that are involved in the care when you come into hospital for
All
stroke.
the nurses, your patient care technicians. We have, everyone. You see the whole gamut.
That's
Dietary,
interesting.
everybody.
And then once a person is released, they can go home generally or not?
So again, it all depends on the severity of stroke. So ultimately, the goal is to get people back to being able to live, possibly with, learning to regain their lost functions and how to live with it and how to use adaptive devices. They may have to walk with a walker. They may need, some assistance at, holding a spoon and whatnot. So it all depends ultimately what the stroke has affected, how, bad the effects are, but ultimately, like, we are trying to get them to learn how to live with those deficits, how to learn
Okay.
to live with those disabilities. So that's why some patients may be able to go home with in-home physical therapy. Some may need to go to an acute rehab and learn, regain strength and learn how to use adaptive devices and how to, learn how to do things with the, the disabilities that they may now be faced with.
Okay, so it's really all over the
It,
place.
it really is. It's all patient-specific.
And it could be at home physical therapy or going into
It
a
could, yep.
facility.
Could be, short-term rehab, long-term rehab. It all depends
Right.
on the patient there. It's very
And it
specific.
depends on the patient, the type of stroke they had, how severe.
Right.
Yeah.
It's all about maximizing recovery and improving the quality of life.
Yeah, right. Are there questions that people should be asking their primary care physicians when they're going in for their physicals and annual checkups? Are there anything that they should be focused on, or really, as long as they're living a healthy lifestyle and taking care of all the controllable health risks that you can do?
Well, the big thing is recognizing the risk factors and speaking with their primary physicians on those risk factors. So
Okay.
things like, as the high blood pressure, should I be on medication? Is the medication working for me? Is my blood pressure in the right range? And that's why one of the things we're giving out are the little logbook so that they can, keep track of it so their physicians can see, what their blood pressures are.
It's really taking control of your own health, really. Like you said, sometimes you'll see the doctor, but they'll take your blood pressure one time at a certain period of time, at your appointment, not, throughout the day when maybe, you're feeling more headaches, when you're feeling more tired, maybe,
Right.
when your ankles are swollen at the end of the day, they're not seeing that. So if you have the logbook, you can go into your doctor and show them, hey, these have been my blood pressure 3 times a day for the past week, for the past month. And then they could be like, oh, okay. Some people have the white coat syndrome and their blood pressure is really high when they go to the doctor.
Just-
And that's,
okay,
and
naturally.
that's just because they're nervous, and that's not really, it doesn't paint their whole picture. So,
Right.
Yeah. So recognizing the risk factors and just having that discussion with their physicians and in their care.
Right. Oh, that's interesting.
Mm-hmm.
I was thinking about, what are the top health priorities that seniors should focus on, but really it's everything.
everything.
Maintaining an active lifestyle, that's the biggest thing. Is studies have shown that even small amounts of exercise will help reduce, stroke.
Is that right?
So, yep, so just maintaining active, just, getting up, moving around, getting, being active. If you do have the, comorbidities of the risk factors of the high blood pressure, high cholesterol, staying on your medications, making sure that you do take your medications, keeping them, filled and not, running out and going weeks without taking them, things that really, just being on top of things and being on top of your own care.
Wow. Yeah, that's really interesting. This has been a fascinating conversation. I've learned a lot, and I think that our viewers have as well. Is there anything else that we haven't talked about that comes to mind that you want to share, or do you think we've covered the gamut here?
I think that the big thing is just what to expect when EMS arrives to you. Making sure that you're calling as soon as possible. Don't be afraid to call 911. If something just doesn't feel right, it's better to be checked out and have that sense of relief that it wasn't anything than wait too long and then find out that you'd have lifelong, damage that could, potentially cause, harder, time at home. So, recognizing that, calling 911, when EMS gets there, they're going to be asking you all the same questions. Having everything up to date, having your medications, having your medical history up to date. Like you said, the File for Life is great. It has everything compiled, but if you don't have one, even just writing it down on a piece of paper, because that's something that we as EMS will do when we get inside. We're going to get your date of birth, and we're going to ask for your allergies, your medications, and your history. It all comes with us to the hospital. And a lot of times we hear, patients say, oh, they already have it at the hospital. But EMS also needs that kind of stuff as well.
But things change as well. Maybe what we haven't seen you in a year
yeah.
or 2 years, so that's why we always ask, maybe you developed a new allergy and we don't know it yet. That's why, we say, do you have any new allergy?
Medications are always
Yes,
changing.
Yeah.
absolutely.
Always
Are you
changing,
still taking this medication?
Or the amount of the medication.
Absolutely. Or no, I don't take that anymore. They switched me to something else. Like, write it down. It's okay. We love it.
Yeah, Tammy, no, that's a great point, is that just because you've written it once, you should be probably, how often do you think you should be looking at that and renewing that?
When there's a medication change. Yeah.
So every time you have a medication
Yeah.
change, think about changing.
Yeah.
If not, at least every 6 months.
What do
Yeah.
we call this? The file.
File
for
of
life.
life.
For
Yep.
life.
So every time you have a medication, go on to this thing right here on your refrigerator where it should be, and make sure you update that and change that so that they've got the information they need in order to take the best care they can.
And sometimes we've had people bring in the File for Life when they come into the emergency department, and sometimes they have a really big medication list and it won't fit on there. So we have people and they've written it on a separate piece of paper. They just folded it up and stuck it in there with it, and that's just as good. And a lot of times we'll say, if people come in and they have a medication list, I love lists that you're going to give me, and I say, this is fantastic. Can I take a copy of it? And I'll have to go to the photocopy machine, take a copy,
Right.
put your patient sticker on it, put it in your chart, and then I can go back and update it, after. But it's already there, and I know it's updated from you because that's where I'm getting it from. So that's
I think that's a great point. So it doesn't have to just fit on this list. You can put an extra piece of paper in there with
Absolutely.
any information you need. Another suggestion that I would think, because everybody has these things, these
Oh,
phones,
yep.
is take a picture of this and create I'm a big believer. I have 63,000 photos on my phone, but they're all in files. And I would suggest that you take Because if you're not home and you have an emergency, if you're not carrying something like this with you, you're going to need the same information. So if you've taken pictures of this on your phone and create a folder in your photo file just saying emergency information, it's easy for you to access that, and you can share that with
People also put it in their notes section. I have
Or
one
note-
for my
right.
parents. I have their
Right.
their allergies, their medications.
but think about how to
curriculum.
use the cell phone as a means
Absolutely.
to
Or just also, like, whenever someone goes to the hospital, and this is something we're also gonna be doing, part of this initiative is handing out folders. Keeping all of your medical history, like your discharge paperwork, stuff like that, or
Right.
from, if you see an oncologist, if you see a different urologist, or, whatever different doctors, if they have specific stuff, keep all
Right.
your medication stuff or medical stuff together. So we're also handing out folders for people to do that as well.
Oh, wow.
And then we also came together and we put together a community resource guide that we're going to be handing out with our initiative here. And what this is it actually is just a full resource guide of different numbers, contact numbers, for things like financial assistance programs, assisted living facilities, different rehabs, different home care,
Wow.
transportation services, stuff like that, to help get to, to doctor's offices.
Pharmacies,
So
yep.
pharmacies, and of course, we have our Be Fast right on the back of that as well to remind people. But we'll be
Right.
handing this out as well, throughout the community to help, so seniors have this at hand for different resources as well.
Right. Can I see that just for a second? I'll show that. Yeah. So if you happen to see these two advertised for a in-person discussion, I would strongly suggest that you do that. And an acronym is the word I was trying to get out earlier, and I couldn't think of it. But the acronym for Be Fast, make sure that you're familiar with that and what that means with those letters. But I certainly want to thank the two of you for coming in. Chrissy Humason, the nursing supervisor and stroke program coordinator, and Tammy Westcott, emergency department education coordinator at Bay State Noble Hospital. You have been fascinating. I know if I ever have a stroke, and I hope I don't, I hope it's with the two of you right there ready to take care of me, because I know that I would be in great care. But I think if there's one thing that we've learned, learn an acronym, Be Fast. Call 911 if you suspect anything. Speed and time of intervention is really, really critical. And start modifying those health risks now. Think about your diet. Make sure you're getting regular exercise. Think about your medications. Talk to your physicians and make sure that you have a good understanding of what those potential risks are and what the warning signs are of coming up. So this has certainly been a all-encompassing conversation around strokes, what they are, how to take care of them, and the follow-up with that. So don't forget that this program does broadcast every Tuesday and Thursday throughout the month at 2:45. So if you want to watch it again, you can. It also is taped to YouTube, and you can find that by going into our YouTube channel. If you call the Westfield Senior Center, they've got a listing there, and they can tell you exactly where to find it. And certainly Tina Gorman can help you. So special thanks to Pete Coles, our WCPC Westfield Cable Channel 15 manager and producer, for making this show possible. And on behalf of Pete Coles, Mike Squindo, and Tina Gorman, I'm Harry Rock, and this has been another edition of the Westfield Council on Aging Presents. Thanks for tuning in. We'll see you on the next show. Thanks.